Okay, good evening everyone. I'm Kristine. I'm the Head of Nursing here at Demeter Fertility. Thank you so much for joining us today. Let's run through some information about fertility treatment and what you can expect. So basically tonight we're going to cover some key information about the fertility process from initial consultation with the doctors all the way through the steps involved in a treatment cycle. I'll start by introducing the Demeter team, our doctors, our approach, and the Demeter difference. After that, I'll go into some further details about how we can approach the treatment options and the support we offer here at Demeter. So as you can see, we're really proud of the accomplishments we've made with being finalists and awarded winner in several of the business awards over the years. We really pride ourselves on our customer service, so that's something we're always striving towards. So who are we at Demeter? So Demeter Fertility is owned by Dr. David Knight, who moved away from corporate clinics in 2009 to set up Demeter Fertility, which is a privately owned fertility clinic. He did this to avoid the red tape and prevent stakeholder profits dictating patient care and ultimately allowing for individualised treatment approaches for all patients. Here at Demeter, we see patients from all over Australia and across the world, and we have a really good streamlined remote treatment process in place to make that easy and straightforward for all people involved. We're a nice small team and like a family business, so you'll always know who you're talking to if you're coming through Demeter. So on the screen there you can see our four doctors, so Dr. David Knight, Dr. Jean Winata, Dr. Farhad Ramhipana and Dr. Tony Bashati, who are all very experienced in women's health and in fertility. So we pride ourselves on our individualised approach and commitment to patient care, and that can be seen in the recognition of the awards that I showed you previously, with the latest being being awarded the Best Fertility Clinic in Sydney in 2024. So here at Demeter Fertility, we have a really strong set of core values. Ultimately, we have a no barriers approach. We don't discriminate and we accept all ages, sexual preferences, health conditions. So there's no limits on what we offer to everyone. So we believe it's not our decision who is allowed to have fertility treatment, and we'll support that anyone who wants to explore their options with having or expanding their families. Ultimately, we don't want you to feel like just a number. We know that every patient has different needs, both medically and emotionally, and just within their whole circumstances. So we do really pride ourselves on giving a personalised treatment and approach so that you can feel like all the decisions are being made specifically for you, because we are doing a treatment protocol based off what is required for you as an individual. We take a whole body natural approach. We have the philosophy that we know that all the cells in our body are connected, and we believe this holistic approach of treating the whole person, not solely the reproductive system focus, means that we can provide the best outcomes and the best ability to get us where we need to be for your fertility treatment. We offer things like mild ovarian stimulation and do extensive broader testing that many other clinics wouldn't offer, to look right down to the cellular level as to ways that we can approach your treatment to ensure that we get the best outcomes possible. We have one of the largest donor ranges in Australia, and we also have a no wait list access to our donor program. So that's both for eggs and for sperm, and we have the ability to facilitate you getting your choice of sperm or eggs from our recognised donor banks within a really quick time frame, which is often a really helpful step for people that are wanting to get things expedited. We offer ovarian PRP, which helps to stimulate the ovaries and allow for better quality eggs. And we also offer a dual stimulation protocol whereby we can offer multiple egg collection cycles in a shorter period of time. We are innovative and supportive. At the absolute bare minimum, we want you to feel as though you've tried everything and we've given our all to get you the outcomes that you want. So before starting IVF, what happens? So basically the first step to all of this would be to get in contact and either have a chat with me, or you've done the first step, you've joined us here tonight. The next step is then to book in with one of our doctors. So we've got the 4 doctors that I listed earlier that are available for consultations, and we would then bring you in at the suitable time. We can either do that in person in our clinics, or we can do that over Zoom, whichever works best for you, with your schedules and also with your location. So with that, the doctor consult will include an extensive family history and medical history, and a fertility screening, some blood tests to get an idea of where your baseline is at. The doctors will also then generally go through a health plan, so looking at your diet, your exercise, your sleep, vitamins and minerals, supplementation, to take a fully holistic approach in how we are looking at your body and how it's functioning. The next step then is the follow-up consultation. Once we get all your test results back in, the doctor can then discuss those through with you, discuss your individual chances and expected success rates based off your individual results, not off what's happening with everyone else. Nursing consultations are something we offer in between all of our doctor's appointments to ensure that you're understanding the information given and that you know what the next steps are. We are a small team, so all of our staff are really helpful in being able to answer your questions. And as I said, there's opportunities for you to book in and chat with the nursing team throughout the whole process as well, in each step of the way. We also have a donor coordinator that's available to discuss any donor options that you might need, and also counselling consultations as required. So once we have the initial consult and the follow-up consultation with your doctor, we'll generally be looking at getting a treatment plan in place. Now, once that happens, you will have a bit longer appointment with the nursing staff to be able to get everything up and running and ready to start your treatment. So step by step, what happens in a fertility treatment cycle? So first of all, there are lots of different types of fertility treatment cycles, as you may be aware. We do have what you would consider standard fertility treatment of IVF, or ICSI, where we inject the sperm directly into the egg. We also offer egg freezing, ovulation monitoring, and IUI cycles as well. So there's lots of different options there for your fertility treatment cycles, and the doctor would discuss with you what the best options would be for you, but ultimately that decision will come down to what your preferences are. So when we're starting a cycle, we do what we call a nursing medication teach, where you come and have a one-on-one session with our nurses. If you're a couple, we generally invite both parties to come along and learn how to use the medications and teach you how to do any injections that might be required, explain to you side effects and potential symptoms, and what to expect throughout the whole process. Then we get you to call up on day 1 of your period and we get you started. For those of you that are wondering what happens with people that don't get regular periods, we also have ways to either get that happening for you, or to be able to get you started based off your hormone levels instead. So once you've called up on your day 1, we have a chat with you and we remind you when to start your medications, when to have any blood tests, and when to book in some ultrasound scans. Now, during the process, we generally tend to do a few different ultrasound scans along the way. Our nursing staff perform the ultrasound scans if you're close to us and accessible to the clinic, and they're done in the mornings so that we can give you a treatment plan by the afternoon for next steps. They're internal ultrasound scans and they can be a little bit uncomfortable, but they are a necessary part, and we are happy to workshop with you if that's something that's really uncomfortable for you, ways that we can make that more comfortable. Once your body is ready for an egg collection, so once we're seeing some follicles grow and we know that there's the potential to be able to collect some eggs, we will prepare you for an egg collection. So the egg collection has 2 different options. We offer a local egg collection, which I would suggest about 98% of our patients would do and opt to do if they're able to, which is where we use pain relief, really effective pain relief while you're awake, to have the egg collection while you're in the clinic. It is a safe and effective way to do the egg collection, and many people that have done egg collections while they've been under general anaesthetic or under local have opted to do with the local option for their subsequent ones. So there's also then the option of doing a general anaesthetic. That's performed at our hospital close to the clinic, and that means that you are put under a general anaesthetic and you're asleep for the procedure. That does take a lot of time out of your day, so we often do suggest doing the local procedure if you're comfortable to, but everyone has a personal preference and we're happy to work with you with whatever works best for you. Once we do the egg collection and we've got the sperm ready to put with the eggs, if that's what we're doing, we would then work towards getting an embryo transfer. Now, embryo transfers happen anywhere between kind of the day following the egg collection up to 5 days later. So that will be determined the next day once our embryology team, our scientists, have checked the embryos and checked that there's been fertilization of the egg and sperm. Obviously, if we're doing an egg freezing cycle, that step is omitted and the eggs are frozen on the same day, and you know the outcome on the same day. After the embryo transfer, which is a really simple procedure that the doctors perform, what happens is that it's just like getting a pap test done. You have a speculum put in and the embryo is inserted by the doctor along with the scientist to ensure that the embryo gets to the place that it needs to be. The next step after that is the pregnancy test. Often the hardest and longest wait of your life is waiting the 10 days to 2 weeks to find out whether it's been successful and whether you are pregnant. We do that via a blood test, which we will give to you in advance, and we get you to do the test in the morning, and then by the afternoon we will give you a call and let you know the outcome of that result. Obviously, if you are pregnant, that's excellent news, and that's what we would like to be seeing every time, in which case we would then book you in to see the doctor to have a check-in to make sure that everything is progressing well. If unfortunately we don't have a successful pregnancy, we will then have a follow-up with the doctor and or the nurse to determine where your next steps are and to answer any questions that you might have along the way. So I know that a lot of you have submitted questions beforehand, and a lot of people had asked about what the costs are and what's involved. So I wanted to just run through what costs are involved in a fertility cycle so that you can understand where the fees are coming from and what they cover. So a total cycle cost fee includes any blood tests, any scans done in the rooms at the clinic, any doctor consultations during the cycle, nursing consultations and phone calls, your treatment plans, any monitoring that we do of the blood tests and any scans, insurance, the procedures themselves, and access to the PBS medications, which I'll explain in a moment as well. It also involves the freezing of any of the gametes that we collect. So that would be the eggs that we collect or any embryos that we do make. And the first year of storage with our fees is included in that fee, that initial fee. So our advertised fees include all of this, and there's no hidden extras for an embryo transfer in a fresh collection cycle. So what's not included is what a lot of people want to know as well. So given that we see patients from overseas and from interstate, the one thing that isn't included with that is the external monitoring. So any ultrasound scans that are done outside of the clinic, whether you're choosing to do that because it's more convenient for work or whether it's because of a distance issue, you're interstate or from another country, those fees aren't included and unfortunately can't be processed through Medicare while you're undergoing a fertility cycle. So they are additional costs that you may have to bear as part of the treatment process. Although, as I mentioned earlier, the medications are subsidised on the PBS, there is still a cost for those, and that is additional to the cycle fees. Generally, the medications are under about $200 per cycle, and often you'll have spare medications left over if you do need to do a subsequent cycle as well. To put it in perspective, the medications that we use, some of them cost approximately $500 or $600 per box, and we're going through 2 or 3 boxes of those per cycle if you were to buy them outright. Unfortunately, a lot of our patients from overseas will have to incur the cost of the medications if they're not eligible for Medicare. However, those that are eligible for Medicare, they will get each of the scripts for about $32 to $33 each script, and that can include multiple boxes of each medication. That can be run through at an individual level depending on what medications the doctor chooses for you to use as part of your treatment plan, and we can run through the costings of that as you go along. Another thing that's not included, if you do choose to have your egg collection done under a general anaesthetic, the hospital and the anaesthetist do charge separate fees that are separate, completely separate to Demeter Fertility, and they are an additional cost that you may need to bear as well. That said, if you do have private health insurance, a lot of the time that is covered, or there may be a small out-of-pocket or an excess that you need to pay. If you opt to do the egg collection in the rooms, that is all included as part of the cycle fees. If you did want to have a look at what the actual cycle fees are for the different types of cycles, you can check that out on our website. They are listed on there and are reasonably comparable with most clinics around the area as well. So a lot of people have questions about Medicare and bulk billing. What is a bulk billing clinic? What is covered by Medicare? So to put it simply, the bulk billing clinics are clinics that do a low cost or a no cost fertility treatment cycle, whereas a private clinic is a pay for service. There's a fee for service. So generally, bulk bill clinics offer us quite a standard treatment process with a generic protocol. Look, that works for many people, but not for everyone. We here at Demeter often will see women that have quite complex medical issues and need a more tailored approach. Generally, private clinics such as Demeter take extra time and care and offer individualised treatment approaches and extra services like the donor programs, the ovarian PRP, immune treatments, and extended testing. So, who is eligible for Medicare rebates on their cycles, you might ask? And that's really a very open-ended question. It really depends on the individual, and it is generally based off any medical conditions, so age, AMH, endometriosis, polycystic ovarian syndrome. But that said, just because you may have a social reason for wanting to do IVF doesn't mean that there's not a fertility diagnosis as well. As a general rule, every patient that comes through at Demeter Fertility is eligible for the Medicare rebate on their fertility treatment. Even if you are coming in for a social reason for doing, say, egg freezing, the doctors will always look into what background fertility issues or conditions that may be underlying to allow for us to be able to claim through Medicare for you. So when we're talking about fees, what we advertise is our full cycle fee cost with nothing hidden, and that is generally the full amount is payable prior to your egg collection or your transfer procedure. And then we submit a claim through Medicare for you on your behalf, which is paid out directly by Medicare to your bank account or to your chosen financial institution. So then when you hit the extended Medicare safety net, that's the EMSN, which is based on the individual person, you'll receive more back per cycle. So it's capped at around $6,500. So once you've done one IVF cycle in a calendar year, you will then be eligible for that extended Medicare safety net, which means that you'll get the maximum back, which is around about the $6,500 mark. Again, these are only estimates. We can't predict what will be processed through Medicare. That's completely out of our hands. But we like to give you a good idea of what the likelihood is of what you might get back so that you can plan budget-wise. So another lot of questions that I got was about success rates and how successful their treatments may be. So right off the bat, success rates are really hard to determine. There's a lot of clinics out there that advertise that they have really good and high success rates, but ultimately, if you pick and choose the patient base that you are taking on board, then they aren't really accurate rates. So success rates are generally reported by age, not by a diagnosis. So if you're looking at success rates, for instance, on a website, what you're looking at is for a certain age group, how many of those women are getting a positive result or getting a pregnancy or having a baby. It's a little bit more complex than that, because if you've got a medical diagnosis, even if you are younger, that can determine that some clinics won't take you on as a patient. Here at Demeter, we don't discriminate against anyone, and it means that we often see more complex patients, and it does take longer to fall pregnant if there are underlying conditions there. There is, at many other clinics, especially your bulk billing clinics, there are barriers to accessing treatment, and they are generally age cutoff limits, AMH cutoff limits, and BMI cutoffs or other medical condition cutoffs that mean that certain people are excluded from having treatments at those clinics. Your IVF Success is a website that you can log on to and have a look. It's a good start if you're new to looking at fertility treatments. It's a good way to have a look and understand individual rates, but we look at each individual patient and determine what the success rate would look like for the individual. Our doctors, as I said, use that whole body approach to give you the best opportunities to maximize your outcomes for fertility treatment. So as a general rule, we don't exclude anyone from our treatment. We feel like it's the individual's choice to pursue treatment if that's what they would like to do, and that's why we don't have any barriers for age or AMH or BMI, etc. Now, I know many of you have submitted questions, and thank you so much for doing that. I am going to run through a lot of those questions now. So hopefully I will cover off, or if I haven't already covered off all of those questions, I will cover off some of those now and run through the answers and hopefully answer the rest of the questions that you have. So one of the questions I got was, what are the expected outcomes of IVF for older women? So at Demeter Fertility, we do see a lot of women that are older, so over 40 generally. And we see a varied level of success. Now, as I mentioned previously, success rates are not just based off age, they're based off a lot of other factors. And what we like to do is give you the opportunity to be able to access the services armed with all of the information you need to know what your chances are, what your opportunities are, and what treatments are available to you. So that allows us to determine whether treatments such as ovarian PRP may be more beneficial for you, or whether going into IVF might be beneficial for you, or if you may want to look at the donor options available as well. So the next question is, how do you manage patients with low ovarian reserve? So low ovarian reserve can happen at any age. We can see premature ovarian insufficiency happen at younger ages where there is a low ovarian reserve or a low AMH level. And as we get older, especially up to from 40 onwards, we generally see a decline in ovarian reserve. So we manage patients with low ovarian reserve with a very similar process for all of our patients, which is an in-depth look at the history, doing some tests to ensure that we know what the baseline is, setting expectations for each individual patient. That's done by giving basically a statistical success rate of how many egg collections it might take, or the percentage of success that you may see per cycle. That gives patients, especially those with low ovarian reserve, a really realistic idea of what their chances are and what to expect with their treatment and how many cycles they may need to be getting the results that they're after. We do then offer ovarian PRP, which has shown to help with reactivating the ovaries and getting them working properly. So that's something that may be pursued as part of your treatment as well. Again, our doctors will generally give you a plan and all of the options that would be recommended for you, and give you the likely success rates involved with that, and then give you the opportunity to ask questions and to be able to make the decision on which treatment path you want to follow. Now, none of that's ever set in stone. We are there every step of the way to be able to ensure that you are comfortable with your treatment and you are choosing the path that you want to be going on, and are happy with how that's progressing. So next question was what support is offered for those doing IVF solo without a partner? Now we do have all different types of patients. We have heterosexual couples, we have same-sex couples, and we have solo women doing using donor sperm or egg freezing. We offer support every step of the way. The nursing team are always available to be able to book in consults throughout their treatments to ensure that you've got the time to be able to ask the questions that you have, and so that you're comfortable with every step of the treatment process. Our whole team is well versed in what to expect during your treatment and are generally able to answer any of your questions that you may have. We do like to ensure that you are well supported with our internal team, and we also have a counsellor that we can refer you on to if necessary as well. So the last question I've got here that was pre-submitted is, why doesn't fertility treatment work even after multiple cycles, and how do you review for better results in subsequent cycles? So that's a difficult one. I think from my experience with patients at Demeter Fertility, most patients have a good idea of what success is going to look like and what their journey may look like based off what the doctor has predicted will be their likely successes. Often the doctors will tell you how many cycles are expected to be able to get your outcome, which for most is to have a baby. And generally that may take multiple cycles. It isn't necessary that we can guarantee after one cycle we can get you a pregnancy. It really depends on a lot of circumstances, both just with biology alone and also with your individual circumstances, like your AMH and your egg quality. So I can't really answer why it's not working after multiple cycles. That is something the doctor does explore, and we always offer the opportunity to have extra consultations with the doctors to discuss what may have happened in a treatment cycle and what we can do differently the next time if required to try and get a different result if necessary. So we do regular reviews of cycles, both across the whole team, but also individually with the patient and the individual treating doctor, to ensure that we are taking all of the steps we can to ensure a good outcome for you. We believe in not holding anything back, so if there's something that's recommended to you as a treatment option, it means that that is the best treatment option that the doctor has been able to offer you at that time. Obviously, we always add anything new in that's coming up and emerging in the health literature, in scientific publications. Dr. Knight is especially keen to look into new and upcoming and innovative ways that we can help improve outcomes. So we're always reviewing to try and get better results for our patients as well. Now, I can see that some people have asked questions. I am going to try and access those now so that I can answer those for you as well. Just bear with me for a moment while I get that up and running. Sorry, I'm having a bit of issues getting these questions up. Just bear with me for a minute. Look, if you are keen to book in with us at Demeter, you are welcome to call the number at the bottom and during business hours to book in a consultation with one of our doctors. If you still have a lot of questions that I haven't answered tonight, you are welcome to scan the QR code or log onto our website and request a one-on-one session. That I generally take all of the one-on-one sessions that you book in. Sometimes you may get one of my colleagues, but I'm generally the one that takes those. So you can book in a one-on-one Zoom session with me to have a half an hour conversation about the treatment options available at Demeter and to check whether it's the right fit for you. One of the things that I do suggest if you are just getting started in looking at fertility treatment options is to find the best fit for you. You want to feel comfortable in the clinic that you're going to, and you want to feel confident in the treatment that you're being offered. So I think the best way to figure that one out is to call clinics and see whether you feel comfortable with the people you're talking to. So I would be more than happy to have one of these sessions with you to see whether you wanted to pursue treatment with Demeter Fertility or whether I can answer any questions that you might have that I haven't run through tonight. I will try one more time to get these other questions up and running, but if I can't, I will have to end it there. So I'm just having a look now. So I can see someone's asked, does Demeter Fertility Clinic transfer for more than one embryo? So here, the Australian rules state that we can't transfer more than one embryo in women that are under 35. That is generally at the doctor's discretion after 35. Using donor products, it is based off the age of the donor, of the egg donor. So even if we are over the age of 35, we can't transfer more than one embryo at a time, and that's because having multiple pregnancies does put a lot of pressure on the body, and it puts both the mother and the babies at risk. So that's not something we do regularly. It is something that we can explore if you meet the right criteria. So if you are above 40 and have done multiple cycles and we're not seeing successes that you want, we can look at putting more than one embryo back. Just remembering that transferring more than one embryo doesn't necessarily increase your chance of falling pregnant, but it does increase the chance of having twins. So that's something to consider, and it's something that we would go into more depth about if that was something that we were looking to pursue for your treatment. So I've got another question here, which is, what are the major causes of failed IVF and implantation? And does your clinic provide a meal plan before and after embryo transfer? So generally, the major cause of failed IVF or failed implantation, so ultimately not getting a positive pregnancy or having a live birth, is what I would consider a failed IVF cycle. Generally, the major cause of that is that the egg wasn't genetically suitable to make a baby. And knowing that we don't always make an egg every month that is suitable and genetically able to make a baby. is something that's really worth remembering. Basically, a woman in their 20s with no fertility issues would take 3 to 4 ovulations or 3 to 4 periods to be able to produce 1 egg that makes a baby. That is an average, of course. There are exceptions to that rule, but as we get older, or if our AMH is lower, it generally means that it would take us more cycles to be able to get the outcome that we want. We don't, for the second part of that question, we don't generally offer meal plans before and after embryo transfer. I know there's a lot on some of the blogs out there about your what you should be eating before and after, and there's lots of strange things out there, like McDonald's chips, I believe, is one of the things that people talk about having after an embryo transfer. Basically, there isn't anything we recommend. The doctors will run through a healthy eating plan prior to you starting, because working on your diet is helpful at the beginning for egg quality and ensuring that we are getting a good outcome based off how your cells are functioning as a whole person. And I have one last question that's popped up, and that's can you do IVF if you have a high BMI? Yes, as I mentioned earlier, we don't exclude anyone from treatment, including if you have a higher BMI. Generally, the doctor will talk to you about options that might be available to you to help with maintaining a good and healthy weight and exercise and diet. That said, you're definitely not excluded from doing IVF. The doctor would talk to you about the risk factors involved in success rates and BMI, but we do have women that come through that have a higher BMI and are able to have successful treatment, and you're definitely not excluded because of that. So it seems like that is all of the questions that have popped up at the moment. So as I said, if you would like to book in to talk to either myself or to book in to see the doctors, call the number at the bottom or scan the QR code and book in that one-on-one session. And I'd really love to chat with you soon. I'm just checking whether any last-minute questions are coming through. Doesn't seem like there are, so I'm going to leave it there and say thank you so much for everyone for joining tonight. I hope that we've covered all of the questions that you had about fertility treatment and the services we offer here at Demeter Fertility. We really hope to see you soon and hope that we can give you everything that you're after. Thank you.